Hi, I'm Emily Piassick, and I am the Director of Mercer's Counseling and Psychological Services. We go by CAPS, and today is our first Wellness Wednesday of the year. So you may be joining us for the first time or returning. Welcome back if you are returning. Today I'm going to talk about kind of CAPS and what our services are about, and if we have time, we can talk about relaxation and maybe do a deep breathing exercise. But today I really want to focus on our services so that you know what we offer as well as how to get in touch with us, those kind of things. So first thing, as I said, I'm the director. I'm a licensed psychologist and I am one of the therapists. We are made up of a bunch of highly trained, qualified counseling professionals. Crystal Allen Joyner is a LPC, a licensed professional counselor, and she's our assistant director and will be joining us at CAPS for the very first time on our staff next week. Ruvan Warasuria is a licensed marriage and family therapist. He's our staff counselor. And Tucker Dadas and Laura Evans will be our intern or practicum students. Tucker is in the PsyD clinical psychology program on the Atlanta campus, and Laura is in the marriage and family therapy master's program. And then Ginger Evans is our wonderful administrative assistant who helps us run the entire office. So those are going to be some of the names that you hear at the counseling center. So what do? We provide confidential, individual, and relational counseling to all enrolled students on the Macon campus. We are working with medical students on the Savannah and the Columbus campus, and then there's also the counseling center in Atlanta for those folks. When I talk about individual therapy, what I'm talking about is personal one-on-one counseling, talking about things that are going on with you. Students come in for all sorts of things. Some of it's kind of adjusting to their academic program. Maybe it's being away from home for the first time or in a new city or a new state. We talk to students about anxiety, depression, eating disorders, relationships, family issues. Sometimes we talk about harder things like suicide, homicidal ideations, bipolar, again, kind of you name it, we're seeing at the counseling center. So please know if you are coming to see us that we're able to work with a whole variety of different topics. We also provide what's called relational counseling. And what that means is if you are in some sort of relationship with somebody, whether that's a partner relationship, family, roommate, friends, we're able to work with you and the other person or persons when, as long as one of you is an enrolled student and as long as everybody is in the state of Georgia at the time of their appointment. Other things you need to know about what we do: there's always a counselor on call 24/7 for the university, and we respond to crises during the day and after hours. So if there is an emergency, know that there's always a counselor on call for the university, and Mercer Police helps us with those emergencies, and I'll talk about that in a little bit. Other things that we do, we help students find providers who provide medications. So we aren't able to provide medications here at our counseling center, but we can help you find a psychiatrist or a medical professional in the community or through student health or Mercer Medicine that can provide those kind of medications for you. We also do a lot of consultation. So like if you are worried about a friend or somebody you care about, you can call and say, hey, I just need to consult with a therapist, and we're able to do that too. Sometimes we'll hear from friends or family members or parents or professors that they're worried about students, and although we will not be able to identify whether a student's being seen here or not, we can talk to them about how we could help or how they could help. All right, so how do you make an appointment? How do you access help with us? I encourage you to look at our website. So our website is counseling.mercer.edu/Macon. As I mentioned, there's an Atlanta campus. So if you just typed in CAPS Macon, it'll give you to our site. But if you just type in CAPS, it'll show you Atlanta also. So you want to make sure you're picking up the Macon one. So on our website has lots of good information about what to expect when you come to the counseling center, our phone number, how to make an appointment, as well as a whole bunch of different resources, self-help kind of resources. So Maybe you need some stress management ideas. There's a whole section on that. There's a whole section on sleeping and other self-care kind of areas. So I encourage you, check that out. It's a lot of information that may be able to help you throughout your day, throughout your week. CAPS is located behind the Mary Aaron Porter Residence Hall, which is one of our first-year residence halls. We're attached literally to the back of that building. So if you live in that building and you are going to your car, you pass our building on the back side. Due to COVID still being a major issue in our country and around the world, we are offering telehealth counseling and in-person if needed. So know that those are options. And with the telehealth component, what's nice is if you are wanting relational counseling, the person that you are in relation with could be in, Athens or in Atlanta or something like that, as long as they're in Georgia. To schedule an appointment, all you need to do is call the office. And I can give you the phone number, 478-301-2862, and ask to make an appointment. Ginger is usually the one who is going to be answering our phones, and you'll be talking to her. She's just going to ask you some general questions, your name, your ID number, a phone number to reach you, and then she will get you scheduled with the next available appointment and based on your availability also. We require that students make their own appointments. So like if you have a parent and they want to schedule an appointment for you, we ask that the student who is wanting the appointment calls. And the reason we do that is so that, you're showing initiative, like you really want to be there. So like even if your mom says, hey, I think you should go see a therapist, I made an appointment, and you don't feel like talking to us, it's not really going to work. And so counseling's not going to work. You're not going to want to talk to us. So we want you to be ready to say, okay, I need to talk to a therapist and I'm making the appointment. Every time you call the counseling center, you will be asked if it's an emergency. And if you say it is an emergency, you will then be connected with the therapist on call, who will do an initial assessment of what's going on, talk to you about what the emergency is about, and then go from there about the next plan of action. So that means that if you call, you say it's an emergency, and I'm on call, I'm going to ask you kind of what's going on, and then we'll determine, do I need to get you in immediately for an appointment? Can it wait till the next day? That kind of thing. So you will always be talking to a therapist on call if in case of an emergency. And emergencies are things like you're having suicidal thoughts, you're hearing things or seeing things that other people don't, you've recently gone through a traumatic event, you haven't slept in 3 or 4 days, or it's really urgent, and although you don't meet those categories, you feel like you need to speak to somebody immediately in order to be safe. So that's what makes up an emergency. During hours, you will just call the counseling center, 8:30 to 5, and then after hours, you will call Mercer Police for assistance, and they will get in touch with the counselor on call. So all of our services are confidential, and I think that's a big question for people, like, what happens if I talk to somebody at the counseling center? Will anybody else know that I'm coming to the counseling center? And the answer is everything that you say in the counseling center, whether that's in our physical building or on our telehealth platform called Doxy, everything is held in the highest confidence. So whatever you say stays in there, stays with us. The only reason we would break confidentiality is if we thought you were in danger of attempting suicide or homicide, or there was some disclosure about active abuse to a vulnerable person, like a child, an elderly person. We have to make sure you're safe and the other person is safe. Otherwise, as I said, everything stays in the counseling center. If you are under 18, you will need guardian permission or parental permission to be able to work with us. So call us and we will help you navigate that. As I said, otherwise everything stays here at the counseling center, does not become part of your academic record, nothing like that. Somebody can call and say, hey, I know so-and-so's at the counseling center, and we're going to say we can't acknowledge or deny that we're seeing you. If you did want us to disclose information, you would be signing a release of information form, giving us specifics of who we can talk to and what we can tell them. So we're really, really serious about confidentiality. we could potentially lose our professional licenses. So we're not going to do that. Plus, counseling's not going to work if you don't feel like it's safe. And so we are very adamant about confidentiality and making sure it's a safe place for students to come. The other thing regarding confidentiality is CAPS is not, NOT, not a mandated reporter for Title IX. So that means that somebody can come into our counseling center and talk about any type of form of sexual misconduct, and it's going to stay at our counseling center. We do not have to report it to the Title IX office. So that's important for you to know and to remember. So what else do you need to know about the counseling center? Let's see. All of our services are free in the sense that you paid tuition, so you've paid for it on some level, but there's no additional fees. We don't take insurance, nothing like that, and so you don't have to worry about any type of payment. You can seek counseling at the counseling center throughout your career at Mercer. So, whether you're in graduate school for a year, 3 years, 4 years, whether you're an undergrad, you're here 4 or 5 years, we are able to do that. We're able to work with our students throughout their career. We're not seeing, usually in those kind of situations, we're seeing students maybe for a period of time frequently, and then they return maybe second semester or something like that. But unlike other schools that have a limit, we don't have that right now. We are seeing students every other week. So that bi-weekly means that you'll meet with a therapist, and then you'll be scheduled in 2 weeks for your next appointment, unless there's some sort of emergency situation in which you and your therapist will determine what's best. If you feel like you need weekly counseling, we can make referrals into the community and help you find a therapist in the community who could be able to provide that. We don't have any kind of online scheduling, so as I said, you just need to call us and we'll get you scheduled. And the length of treatment just kind of depends on what's going on with you. Sometimes we see students a couple times, and as I said, sometimes we see them on and off throughout their time at Mercer. So self-care is important, okay? It's really important. And a lot of times we kind of put up this front that everything's good. We're good, I'm fine. Don't need to talk about it. Maybe you come from a family that you just, put on a nice smile and don't tell anybody what's really going on. But the fact is, life gets hard and things come at us that it can be really helpful to talk to somebody that isn't a parent, that isn't a friend, that can be a little bit more objective. You've got a lot of demands on you with school, navigating friends and family and all that good stuff, and so it's really important that you be able to take care of yourself, and counseling can help with that. We encourage you to use our services not only just to help with existing personal challenges, but also to prevent future ones. So like if you're starting to feel really overwhelmed, that may be a good time to reach out to us versus being fully overwhelmed and not being very productive and effective. So, notice when you've got some red flags going on. I also want to encourage you, so you're watching this on Instagram Live, to follow us and Mercer_CAPS so that you can see little reminders as you're scrolling through your feed of, hey, how are you taking care of you? Remember to breathe. Hey, there's a Wellness Wednesday coming up. So it just kind of breaks up your kind of routine to remind you about self-care. We're going to be doing these Wellness Wednesdays throughout the year. So if you have a topic that you would like for us to talk about, feel free to give us, leave me a message in this, or you can send an email to caps@mercer.edu and let us know what you're interested in talking about or hearing about. But before we end today, I thought maybe we would do a relaxation exercise. It's an easy relaxation exercise that may just be something you want to use throughout your day. I actually encourage it. It's just deep breathing. It's a form of mindfulness. That might sound kind of weird and new agey, but what we know about relaxation is that the more we do it and the more mindful we can be, the more we can keep our baseline stress lower. And when we do that, we've got more room when other stressors come into play, which are going to happen. that's what happens throughout our course of our day and our life. So if you can keep bringing your anxiety down, your stress level down, when new things come, you've got some more room versus having like a full bucket of stress and no place else for it to go except being overwhelmed. So this, as I said, this is a deep breathing exercise. Some of y'all may know how to do this already, but what I want you to do is, or what we're going to do is we're going to be breathing in a pattern. We're going to breathe in through our nose for a count of 5, out through, holding it for a count of 5, and then out of our mouth for a count of 5. Again, it might feel a little new agey, but what we know about this is that it will slow down your heart rate. It'll slow down your breathing. It can help you focus. It can help you fall asleep at night. It can help clear your brain. So there's a lot of benefits to it. We're going to do it just a couple of times here, but I recommend doing it like 10 times in a row, and then kind of notice how you might feel more aware, you might feel more grounded. Okay, so are you ready? So what I want you to do is sit up straight in your chair, or if you're laying down in your bed, that's fine. Plant your feet firmly on the ground. And I want you to imagine like your vertebrae of your spine just lined up, one on top of the other, all the way up to your neck. Let your head rest comfortably atop your shoulders, not rigid, just atop and comfortable. Close your eyes, or if you prefer to leave them open, just kind of unfocus them. Okay, let them gaze out at something a few feet in front of you. And I want you to do is place one of your hands, palm open, flat against your belly, like right above your belly button. And then I want you to place your other hand flat against your chest. And as you're learning this technique, it's helpful to have your hands in this pattern, but once you get to do it, you don't have to do this. But basically what it's helping you do is when we breathe in, you're gonna want to think about holding this hand on your chest still. And you want to think about getting your breath down into your belly so that you pooch out your stomach and your hand on your belly pooches out. So when we breathe through the day, and particularly when we're stressed, we breathe here from our chest, and it doesn't do a whole lot when it comes to relaxing. It keeps us alive, right? So you're not falling out, but it's not doing anything as far as slowing down that heart rate. So I want you to think about pooching out your stomach. Okay, so you ready? So I want you to take a deep breath in through your nose, pull the breath all the way down to your abdomen, allowing it to expand. Ready? 1, 2, 3, 4, 5. Hold it. 1, 2, 3, 4, 5. And slowly let it out of your mouth. 5, 4, 3, 2, 1. I'm going to have you do it again, and this time try to see if you can breathe in a little bit deeper. So, you ready? So let's breathe in for a count of 5. 1, 2, 3, 4, 5. Hold it. 1, 2, 3, 4, 5. And slowly let it out of your mouth. 5, 4, 3, 2, 1. And do it one more time on your own. So you're going to breathe in for a count of 5, feeling your hand pooching out by your stomach, by your belly. Try to get your breath in a little bit deeper. You're going to hold it. And then when you slowly let it out of your mouth, see if you can exhale a little bit stronger. So my hope is that felt good. It's something that you can learn to do. And as I said, doing it 10 or 15 times in a row is where you're going to find it being most effective, and doing it throughout your day. I know some of you guys have Apple Watches, and there's a Breathe app on it. Using that as a reminder to do these kind of exercises. I think doing it through your day, you won't even realize how stressed out you are or how much you're carrying until you take a moment and ground yourself. And that's a good way. Deep breathing is a good way to just check in on yourself. What's going on with me? How am I feeling? And what do I need to do to help myself? So again, I hope that relaxation exercise we'll try it out. If you want more of those exercises, check in with us on Wellness Wednesdays. We're not always doing relaxation, but we'll do it frequently. Check out our website. And if you need us at the counseling center, please give us a call and we will get you scheduled for an appointment. All right? Take good care of yourselves and see you next time. Bye.